Hello, good afternoon. Happy summer. I'm very excited to be here today. We are resuming our monthly podcast, focusing on a very exciting topic here, and that's basically social impact and design through entrepreneurship. This is our panel discussion this month, and then also, Saloni, if you go to the next one, if you want to get updates from Loft on a monthly basis, we won't spam your inbox. Please subscribe to our newsletter. But yeah, let's get started. I am very honored to have here Jeff and Leo. They are friends, founders, clients. We've been working with them for 3 years, 2.5 years,
Yeah,
probably,
maybe.
on a crazy project that started as a napkin sketch in Leo's garage, probably. Um, and what's really special about it is really that it's basically two emergency room doctors that saw a need in the market and started a startup. And all the aspects around starting a startup we want to cover today. But I gotta introduce um, Jeff and Leo. So Jeff, maybe you talk a little bit about yourself, and then Leo, maybe you introduce yourself, and then we can go into the topics.
Yeah, thanks. Thanks for inviting us. This is great. Nice to catch up all the time, Gregor. And
Yep.
it's been interesting, I'm sure. I'm a pediatric emergency medicine physician by training. I have training in public health. Previously worked on a no access, no barriers solution for overdose called Nalox Box, and that got me started down entrepreneurial paths. And with Leo, and happy to join this discussion.
Perfect. Leo, please introduce yourself.
Hi, can you hear me okay?
Yes.
Okay, thank you. So yes, thanks for having us. I'm Leo Kobayashi. I'm an adult emergency physician, so I work on the adult side. And so I complement Jeff's skill set and work. And yes, he and I have been working together on various interesting, occasionally harebrained, but generally productive collaborations. And so, yes, we are together with our third co-founder, Chris, who's unable to join us, but we've been working on the solar system. And so, yeah, I'm very happy to be here and hoping to have some interesting discussions.
Yeah, I think, you guys as a client have been very, very fun and joyful. And also, my favorite part of running a design agency is that you have opportunities to work with really interesting folks that really want to make a difference. I want to talk a little bit about kind of mission versus market. Obviously, maybe Jeff, you can explain what Zora does, and then we can kind of dive a little bit into the mission and the social impact of that mission.
Yeah, happy to start. Yeah, so our mission is to address preventable deaths. There are preventable deaths from emergencies where the solution's straightforward and easy. It can be done with minimal training. But if the tools aren't present on the scene of the incident, a person might die, and otherwise they could have been rescued, or they might be permanently harmed. So we're all familiar with defibrillators for cardiac arrest. They're quite omnipresent, but solutions for bleeding and overdose and anaphylaxis or life-threatening allergic reaction are less common. And then this is a totally untamed universe out there about where are these things for the places where those tools do exist. Does anybody know they're there? Are they inviting and labeled in a way that people feel like they can access them and it's there for them? Where our system is basically software as a software company where we're trying to make sure tools are there, but also properly monitored and maintained. And so, very much we have a cloud-based platform which adds infrastructure which does not exist to know where the tools are, and then more tools in more places so that people can help their fellow citizens while they wait for the ambulance, which can be a very long and scary wait when you have someone who's severely compromised in front of you, and you need to have 8 more minutes or 10 more minutes of delay until help is rendered.
Excellent. Yep. And as I said, like obviously, very interesting business model. Software, whatever, hardware as a service, let's call it that. But really, the backbone is kind of like this digital ecosystem that kind of knows if the components are there, where they are, if they're fresh, how people can access them. A lot of mission-driven companies struggle with market acceptance. I'd love to hear a little bit about kind of your struggle between doing the right thing for users, but at the same time also building a viable company, right? Obviously, if there's no market, there's no product, right? So maybe Leo, you can talk a little bit about like how you guys started, and also then what kind of drove you towards the current incarnation.
Well, I guess first off, the struggle is real and it's ongoing, and it hasn't been solved for us. So, I mean, yes. Uh, I guess just to kind of preface this, we got our start with a little bit of, initial personal seed funds, and then, being academics, Jeff and I still have academic appointments. We work clinically, and we work at regional academic healthcare institution. We accessed NIH funds to start everything off, and we were successful in getting an SBIR phase one. And, that's not free money, but it's, accessible money under the right circumstances. And so that's what got us started. And that ties into, the struggle in the sense that, yes, we have the money, we got the start, but then we have to keep going. And, so we raised, and we're now doing our next raise. The point of all this, what I'm describing is that, there are plenty of efforts, projects, innovations and things that get developed. And they, they're implemented, they're prototyped, they work, and then they disappear. And so, you have an amazing product and they're supported by either academics or sweat equity or whatever. And then, the funding runs out, the grant runs out, or, you get busy or you get distracted and then they just unfortunately disappear. And so that ties into the challenge associated with socially minded work in the sense that we do need to have a sustainable business model to make it worthwhile for everyone. And so, it's, we're still working on resolving that tension. And in our case, it's a little bit different because the tension isn't between us and the end user. It's between us and the people who will be purchasing our system and and paying for data, and how to help them fund that so that the end user is actually the person who uses the supplies, has access to them. And so, in order to sustain that, we have to create a sustainable business model, which we're working on, and we're having very good leads. And we can discuss that extensively when as a specific business discussion.
Mm-hmm. Yeah, I think that's a great. I just want to add on to what Leo's saying, which is our system works. It's already saved lives in pilot testing. It delivers value. It's addressing true public health needs and trying to avoid family crises for someone who's lost at a young age. The market solution, will not only keep the company stood up and viable, but it could lead to dissemination. And we've had recent conversations with national distributors of safety tools versus like a direct sales approach, which would be very slow and hard to build. And we have some very active work right now, working with national distributors of safety tools such as defibrillators or even medicines for overdose and anaphylaxis that are strongly encouraging. They have relationships with the customers, and we're learning as we go. We didn't know how distributorships work or how wholesalers work, but our access to the verticals or markets the channels that we need might be provided, and this is to be determined with national distributors of rescue tools who are already out there, already have the relationships with customers, and so that's a really nice turn that we've had recently, which is working towards actually national implementation, national adoption through these partnerships.
That sounds exciting. How do I mean, customer acquisition as a social enterprise is a little bit different, right? Because obviously, you guys are coming from the human-centered side, right? And really building the platform from the ground up. But that's not necessary. As you said, Leo, the stakeholder is not the end user. The stakeholder is really the gatekeeper, the municipality, the hospital system, the school, the whatever public area that is putting these in place. How do you get to these people? Is it through distribution, or is there other means of reaching out?
I think Jeff should answer that, given that he's the one who's doing the majority of the work, and getting hung up on and no doors closed and all that.
Yeah, I mean it's hard, right? Nobody knows they need the tools until they need it. You know, a lot of the organizations who are doing the work, who are advocates for overdose prevention, or even allergy, or hemorrhage, are, you know, working in nonprofits with limited budgets. But there are ways forward on partnering with those organizations, and this is to be determined also. But training or national training organizations are a natural partnership for us. Those nonprofits are doing the training. Some of them even have links to tools, like they will sell actual defibrillators while teaching people CPR. So,
Mhm.
um, you know, to be determined, but there are very many very well-meaning and impactful nonprofits that are small and large who are doing hard work every day, and they've been partners in our development. And we think they'll be part of our story and a part of our success is working with the people who are deeply passionate about these topics. Maybe sometimes built on a tragedy of a lost sister or child or something like that. And you know, that's part of the linkage to our clinical care, which is like we know the pain, we know what people go through when
Right.
they lost somebody suddenly, and it's a particularly deep injury if if it could have been a prevented outcome.
Right. I mean, I think that's the story, right? Really. Um, I want to talk a little bit about our journey because obviously you guys came with a, I would call it crazy idea, right? And
You didn't tell us it was crazy. You thought it was great.
Well, I mean, generally speaking, people would think, building an IoT platform that distributes, for people in care. Um, I, you know, it. Some people might think, it's not that you're gonna go to the design firm first, or either you guys didn't go to a design firm first, but you engaged pretty early, right, in the process, and I think it helped you not only build a great brand, but also a great kind of story. And obviously, Jeff Berman, who's not here right now, was a big part of that. But basically, um, if people on the call are like, "Hey, I have an idea that has social impact," would you say go to the design firm first? Like, what's your guidance for somebody who's coming after you who maybe has a similar idea?
I'm going to defer to Leo on this one.
Okay. Yes, absolutely. Go straight to loft design. Don't, no, not pass go.
No, that's
Don't go
not what I
backwards.
wanted to say.
No, yes, I mean, so I think, in terms of full disclosure, I mean, like, Jeff and I, prototyped and garaged it and, made things out of like, crayon and twine and like, IKEA boxes,
Yeah,
for,
mostly Leo. Yeah.
right. And yes, can we get it to something that works? Sure. I mean, it's tinkering and, prototyping and experimentation, but in terms of getting to something that's, acceptable, that's, that looks like it's a product and something that actually fully delivers and which can be, certificated and meet regulatory requirements and, do the job. Um, I would argue that it's probably the very rare founder team that can do that on their own. And we're not one of them, which is why we worked, we reached out early. And I think our initial interaction was probably through some other related work, but we knew the team at Loft. Once again, this is not a paid advertorial, and I'm not getting it. There's no COI. But yeah, I mean, it just we had the core idea. We had the basic technical um, implementation completed, and we'd actually, fortunately for us, in speaking to the need, we'd actually confirmed, lives saved even at the prototyping stage. And so then it became easier to secure government funding, federal funding, and then, get the professionals to help us. And so I think it's absolutely crucial, essential to have professionals who are excellent at what they do help you on the way to making product.
No, that makes sense. Yeah, but I think you have a naming, branding, everything looks really great. It also legitimizes your value proposition, right? You get taken more seriously than if you show up with a hand cut prototype and say, I have an idea for a product. Um,
Yeah, I want to affirm that. I mean, that's been true this week. I mean, literally, like, you know, we have a business development partner on our team now, and he presents what we have verbally and with just a couple of simple images, and it's immediately obvious that this delivers value to the end user. But then also, they immediately see that this is an opportunity to complement the rescue tools they're already selling. So the attractiveness of what Loft has helped us create, it's won awards. It's approachable. That's one of the major design criteria that our whole team worked on, was how to make this seem like it's there for the end user, for common citizen, and make it not scary and obvious what to do.
Right. And I think that's what differentiates you guys from kind of a tech company, right? You both are doctors. You know the end user's needs really well. And also you've talked to many people that have needs in that space. And, as you said, Jeff, it can be intimidating. Bystanders want to want to get involved. It can look like a medical, construct. So really that entry of barrier must have been very low. And I think from our work together, and maybe when we talk about the user a little bit, I think we kind of work pretty hard in removing barriers, making the iconography as approachable, um, choosing colors that are soothing and inviting. And, overall, like all these aspects were very carefully crafted. And I think we deliver on that promise pretty well. I mean, especially as you guys mentioned, your business development partner is now able to get in a dialogue with distributors on a national level, basically on par with a product that is probably much better funded and much more established in the marketplace.
Absolutely.
I want to hear a little bit about kind of, empathy as a competitive advantage. I feel like you could put this box together and, not have the passion you guys have for what you're doing, and it would not turn out the same way. I feel like you guys really have your pulse on. Maybe talk a little bit about even why you guys made this happen. I mean, it was not like I have a business idea. It's more like I want to solve a need, right? Maybe Jeff, you start, but then Leo, I'll hear from you guys. How that all kind of materialized.
Yeah, I mean, I'll try to be brief, but I gave you the one side of the coin where we received someone in the ER, and we're a level 1 trauma center, and they're too compromised. We have all the tools, all the staff, all the training to help, but if the person's too far progressed in the deterioration, it doesn't help. It had to happen on the sidewalk. On the flip side, we received patients who were received a defibrillator in a timely fashion, who walk out of the hospital the next day. So
Right.
we see both sides of the coin vividly, and that informs our motivation.
Right. Got it. So it's really your daily work, kind of like what's the call to action to make this happen?
Leo receives maybe more
Yes, and
terrible,
so
terrible situations in the adult side. So it'd be good to hear your perspective too.
yes, I mean there's the other cohort that warrants empathy, which is the individuals and small groups and organizations that are currently combating the opioid epidemic and mass shootings and violence. I mean, they're the ones who stock supplies. They're opioid education and naloxone distribution groups. They're stop the bleed groups. They're comprised of moms and dads and family members who've lost loved ones. And so the empathy, I fortunately can't say that I can directly empathize because I do not have that experience, but I do have the experience of having to restock the supplies, and it's truly it's a labor of love. So with these containers, whether be it AED containers in an office building, or if it's naloxone container in a halfway shelter environment, someone has to keep track of them and someone has to replace them. And it is a pain. Like, I mean, do you have to check it every day? Like, because it could get used at 2 a.m. It could get used on the weekend. And so someone has to literally check these every single day. And if they don't, things can go missing. They might have expired. Then, you just won't know until you check. And so I say I can empathize because during the pilot study that was NIH supported, we deployed about several dozen of these monitoring systems. And Jeff and I were essentially responsible for checking on them. Did they get opened? Did they get used? And then tracking down what happened. And so if you scale that to, the tens of thousands, hundreds of thousands of devices and lots of distribution areas in just the US, it's just a huge amount of work. And so, being able to create a system that helps relieve some of the pressure associated with that, so you can, do other important things, it's a pretty strong empathy point. So, and that's what.
I mean,
Yeah,
the status quo is clipboards largely. It's clipboards and walking to, driving to the locations. It's kind of crazy to think in 2026 that that is the is the current system. Using cellular networks like we do, and notifications from the cabinets come through cellular networks primarily. They can go through Wi-Fi, but we prefer cellular. It's a little more robust. And that was a design choice that Leo made on the hardware and tech side, which is let's be on a system that doesn't have to deal with, IT services and other, passwords and systems being down. But in in a land where we can find a scooter instantly, we should be able to find the rescue tools. It's just a real simple, statement about, priorities. We should be at least as high a priority as finding the scooter or the city bike.
Makes sense. I think, what's interesting about your system is really, I mean, as you said, Jeff, in 2025, the whole world should have this, right? It should be a requirement for a new building to have a Sora box in there. I'm not saying this to make you guys a lot of money. I'm just saying this from a simplicity and investment. I mean, it doesn't cost that much. Probably, putting a brick driveway in costs 10 times more than putting a Sora box in.
Yeah, and we'll get there. And it's, there are a lot of there are a lot of indications that we're getting there. The Stop the Bleed campaign for American College of Surgeons is now, there's over a dozen states that have specific Stop the Bleed legislation, which looks different in different states as to the requirements and the goals. But we're seeing almost, I might call it a groundswell of forces leaning into more provision of
Right.
public access tools.
That makes sense. And I think, in a sense, you guys are the carefully designed solution that really can make an impact. And it is very field deployable. And as you said, the cost is really in the restocking. And that's what you guys are taking out, right? Because every box is connected, and exactly what's expired, what's removed, what's used, and you can restock it very, very discreetly or very effectively versus going to every box and kind of driving around every day.
Yeah, yeah, it's an empty box is the outcome that we are set on trying to prevent.
Right, exactly. I'd love to talk a little bit about kind of prototyping. I know in design we think about prototyping as really a great enabler, and I mean you guys have had field trials. I'd love to hear a little bit about how your product perception changed from the initial deployments to what we're doing now to maybe even future deployments as you're scaling.
I think this goes back to our origin story, which was Jeff and myself, and lab, garage, making things that kind of work, but they're pretty fugly, and and then realizing that if we're going to make this work, it can't be fugly. It has to be scalable, it has to be affordable, and it has to meet regulatory and technical specs. And so I keep, going back to NIH, but I mean, one of their, they had some astute reviewers who reviewed our SBIR application and came back with specific recommendations about how to make the system more accessible and approachable and useful. And so those actually help drive some of the prototyping revisions that happen. So from a user interface, human factors aspect, that was a pretty strong driver. And then in terms of evolution of prototype from our version 0.5 to 0.8 to version 1, it's just field trials, deployments and no cost deployments with test partners, and just seeing how they work and what are the tweaks. And fortunately, we made a pretty significant hardware change probably about a year and a half, 2 years ago. And since then, especially with the Loft's help, right? Thanks, Loft. We've had the advantage of being IoTs that a lot of the updates can be over the air, OTA. And so, we've been able to make changes and revise our prototypes to, production validation versions without significant recalls or having to re-engineer the entire system. So I think it's just by virtue of our sort of like hybrid hardware software model in terms of our product that I think we've been relatively spared some of the challenges of extensive redundant prototyping challenges that a lot of other products might encounter.
Yeah, I think that non-dilutive funding, that was the opportunity to actually contract with Loft. I think you guys were doing some gratis work with us for a while, and
Right.
to describe, I don't know if I can describe it adequately, but there were, serial meetings with the Loft group where Leo would come charging up the stairs with, a plastic box, a cardboard box, it's a hand sketch thing, and I think Loft was a very patient partner. And on the other side, Loft coming in from their own design would, put good options in front of us and with a matrix of what was gained and what was lost by each of the components and approaches. So we could distill what we could do at what price and what complexity. So you guys were very patient partners in the process, and we're still not we haven't quit bothering you. We've come to you recently with more challenges.
Yeah, I mean, as I said, this is, for us, this was a once in a lifetime opportunity to do social good while really helping change the world, right? So it's really, I think we're all into this as a mission, right? And obviously,
Mhm.
As I said, you guys being successful is gonna save a lot of lives, and I think that's important to not lose of the focus on, which is, as you know, the healthcare system is very complex. It's a very complex value chain. Many people, get lost in the shuffle, right? So I feel, you guys connecting with the right partners, getting like access to the right funding is really helpful. But also, the next decade will show, can this be rolled out in a different scale, right? And um, um, it's I mean, Leo, your candid conversations. Yeah, I think every business always struggles with a value proposition, right? It's not like one value proposition is set and done. Um, Probably as you're scaling, your value proposition might have to change, right? And ultimately, there's also economies of scale that might actually bring the cost down, which then gives you more access. So it's a chicken and the egg thing that you guys are in. I would call it the hardest valley right now, right? Where funding hasn't probably been as well as you like, but at the same time, you know that you're gonna get to certain numbers to be efficient and compatible with kind of cost parameters. Um, yeah, I want to hear a little bit about also from your origin story. I think a lot of entrepreneurs maybe struggle as they're not really engineers or designers, and they can be very intimidated by product development or like the steep learning curve. Obviously, you guys are both doctors. I know Leo, you were tinkering your entire life. Kind of, you're maybe a little bit of a unusual doctor, but most doctors don't are not very hands-on. I mean, they might be hands-on with patients, but they're not very hands-on with gear and equipment. Um, what was the biggest surprise for you as you kind of like get into the product development arena? And what do you feel like you could give to other people as a learning curve?
I mean, I'll just speak to the product development aspect. One of the most challenging things that I still, go through as we work on our system is sort of the uncertainties associated with product life cycles, and specifically, I'm talking about supply chain components. Just OEMs, manufacturers, and like parts going end of life, and having to just work around all the uncertainties. Like tariffs go up, and parts take twice as long to arrive, or they never arrive, or just all these uncertainties associated with making a product. Because you buy an iPhone, and it comes in this nice engineered box, and it's like, oh, it's amazing, and this must take Apple just 10 seconds to make. But then when you're trying to make something on your own, it just the reality of supply chain and manufacturing and assembly and stocking and shipping, it just comes to hit you. So, and it's clearly more relevant to hardware side of things. Not to say that software doesn't have supply chain issues, but making a physical product that has moving parts and circuits and all that, that's been challenging. And it does tie into the regulatory aspect, because in order to make something that passes muster, I mean, it has to get certificated and safety validated. And so having to make changes and tweaks to the system, it can become expensive and time consuming, and delay launches and product cycles. So it's just all these stressors of making a product, which are quite real, and which I had no experience with prior to embarking on this. So.
Yeah, that's sort of like, the benefit of having some funding, was engaging experts like loft designers or a regulatory expert or somebody's an expert in, PCBs building. And so, as we got to work with engineers and, it is nice to get to a point with your product where, it's people can see the shape and form of it, but then the refinement is really critical for the ultimate function and dependability and value.
Yeah, I would say, what do you feel looking forward? Where is kind of like your next kind of big milestones? And do you think that from a funding perspective, first of all, if anybody's on the call that is writing checks, right? What's your pitch? I want to hear your elevator pitch. And then I also want to hear like what's the next stage and gate for you to kind of scale the platform.
Jeff, you ready to pitch?
You can go first if you like.
Yes, I mean, we're at the point where we have certificated product, we have a little bit of inventory, and we need seed so we can start stocking at distributors and selling nationally. I mean, we have a validated product, it works, and we are trying to establish moats that will help ensure that it's a sustainable business. And in order to do that, we need the funds to scale and get to market and be available to a lot of consumers who we believe are out there. And so we need funding to keep going. We need funding for COGS. We need funding for our tech stack. We need funding for our regulatory and design consultants. Yeah, it's a business, and we're trying to make it work so that we can actually achieve something that helps society.
Yeah, I mean, as much as we've been working on this and getting help from a great ecosystem in Providence that helps startups like RI Hub and Social Enterprise Greenhouse and NEMIC, the best validation we've had presently is hearing from those national distributors and wholesalers that there's a market gap. This is filling a market gap, which we knew, but to hear from people who sell those tools every day is a really good affirmation that we're pointed in the right direction. And um, working out those relationships, we'd spoken to a lot of folks about trying to have some design freeze for our own sanity, and also to know that what the product is, it is. And then, but there are still minutiae that we're adjusting to. For instance, at first we weren't, we're working on with kitters who would put the actual rescue tools in the container, who have the regulatory approval to do so. And so there's one more go around of refining exactly what we want in each of these slots for the rescue box, rescue tent. And that's a small refinement, but there's a development pathway here where you start to add more tools, right? So there's needn't be any real restriction on what we put in the container. Isn't there we're one trick pony? Like we have our product and it's designed for overdose and bleeding, but there certainly are other emergencies that we can address and have plans to address. And then another stage of development is the integrations with the systems that are already out there for tool monitoring, access, pre-hospital systems, and notifications and emergency dispatch. So with the proper momentum, we have product development that is almost obvious that would play out over the next 1 to 3 years. And that's exciting because we want to continue to add the value that we're providing and be amenable to more buyers.
And in terms of attaining milestones and our next milestone, I think I can't emphasize enough how just networking and going to, venture cafe or accelerator events, or just like, meeting people, taking cold calls, just emailing people, LinkedIn, how critical it is because, we weren't quite at a standstill, but we were a little bit stuck. And we were stuck for about 6 months, between product finalization and getting certificated and then, prepping to launch and reaching the next milestone, which is, getting to sales. And I mean, we think we've lucked out, fortunately. It's just it's a connection that Jeff made. It wasn't really a stretch, but Jeff contacted someone, they got to talking, and now that person's helping lead a lot of the BD efforts that we have. And so, just having network connectivity is just a very large component of this because it's not necessarily just serendipity, but I think it's the sweat and the effort that goes into making things happen.
Mhm.
Yeah, I mean, yeah, I think I personally, I'm not sure if this speaks to other physicians, but I think we undervalue networking. It just that we can tend to be kind of siloed. I think, I'm not sure, not making excuses here, but I'm not sure if it's like our long focused training that makes us a little bit more, focused in, and not always thinking about how am I doing building relationships with other, other specialties or other people with great skill sets that are not mine. So, it's kind of a growth phase for us as we do meet and work with people like you, and business development people who have mad skills, like skills things that we were not Leo and I could try for 20 years to do some of these things, and we would never come to a solution. It's just that, we truly value other people's skill sets. And I think, looking outside the hospital has been, really great. I think it has its challenges, but it's really a terrific engagement because there's a big world out there and a lot of people with really great skills, and you're not going to make anything nearly as good as you thought without them.
Mhm. That's really good to say. I mean, I think it's all the value of the team, right? And everybody has a specialty. And really, when they all come together, is really when the magic happens. But it's the same thing with the design team, right? I always advocate for, whenever we have a design problem, engineering is involved, or UX, or regulatory. Like, just have like a group of people with diverse mindsets and diverse skill sets contribute is when the best outcome happen. And you're right the right way. Like also, Jeff, I mean, I understand, and after a 16-hour shift, you don't want to necessarily go to a networking event. So,
I probably shouldn't have, but I was there, mostly awake for most of these.
so you think that the ecosystem in the Northeast is helping startups like you get traction just because of Venture Cafe or Cambridge innovation, things like that.
Yeah, very much so. I mean, our network, our system is, it's a small ecosystem in the province, but boy, if we got a tremendous amount of help from them, we're very thankful, for that.
I agree. Yep. No, I think yeah. I think we have about 20 minutes, so I want to open it up to questions from the audience. But Saloni, you want to start?
I think there's another question also by Aiden.
Yeah. Let's get with your started, and then we go to Aiden.
Okay, sounds good. Yeah, I just had a question about, yeah, like you have been doing this for a while, and I'm sure you would have like gone through different funding sources or like researched different ways of so like putting together funding to get started. So if you could talk about like what's your process like if someone is trying to do that right now or looking for like doing similar things, like what would a process be like for them to get any sort of funding, I would say.
I think it's, get some, I think speak with people who have been down the path before for seeking the, funding opportunity that you have. There's nothing like non-dilutive funding, and we benefited from RI Commerce voucher and manufacturing grants or vouchers, as well as the NIH funding, and also a small, grant from Social Enterprise Greenhouse. So you have to throw your hat in the ring, but you want to know which rings to throw it in, and then and make some assessment of the probability. We didn't have a grant writer per se, but we had a grant consultation with a woman named Lisa Marceau, who's been tremendously helpful in helping us reconsider our specific aims for our grant. Leo and I made a strategic, choice in the first, instance not to pursue the NIH because we thought it was too slow, and then it turned out a year later we were submitting an SBIR, and maybe a year later then. But it's hard to know the timing of it, but that's where you use the people in the neighborhood. First of all, are you aware of all the grant opportunities? Is it right sized for where you are with your development stage as a startup? And then making some assessment of the probability, which is always difficult. There are some, I know of startups in our region which hired grant writers and had tremendous success. And so those people are out there for a fee. But our state even has some supports for supplemental help through NH mechanisms.
Mhm. So basically, know your ecosystem or find your ecosystem is step number one, right? And then really make connections where you need to make connections.
Yeah, Leo, what are your thoughts about some strategies around seeking that grant?
I mean, I think bootstrapping initially, and not necessarily putting off, but just uh, getting started, making do with what you have, learning skills as you need them, like YouTube videos, like web tutorials, like figure out how to solder, figure out how to make a circuit, learn how to 3D print, just starting to acquire basic skills so you can do some truly basic prototyping on your own. And then looking into initial small scale grants, foundational monies in your local ecosystem. And, these grants might be anywhere from like, 1,000 to $5,000 to $10,000 to get you started, and do, like a pilot, make some prototypes, do a pilot, and try to do it in a way that starts demonstrating real world outcomes. So as opposed to having like a shiny, a 3D printed product, if you can show that it actually had an impact on the world, that becomes very powerful, because then that lets you apply for larger monies. And we're a little bit biased because we come from academia. Both Jeff and I are recovering academics, and so we've been fortunate to be able to access, for us, the NIH, but there are NSF grants, there are DOW grants, there are programs that, at least philosophically, as far as we're aware, are helping encourage innovation and new new product R&D. And so just looking to those and realizing that it's not going to be instant money. Like you're not going to apply for an SBIR or an SCTR or the Commerce Grant and get it in like 2 weeks. I mean, it's going to be like a long game, 6 months, a year. And so being prepared to bootstrap and fund while you're waiting for those monies to land, and just keeping moving, so you don't get discouraged or lose momentum while you're trying to secure additional funding to keep going.
If it does have a scientific leaning, there are, as Leo mentioned, the STTR, can have a scientist as sort of doing the science work for a company, as long as you forge a partnership there that might be mutually beneficial.
And that's an important point, because and sorry if this is so Rhode Island based, but that's where we are. So here we are. But there are specific funding mechanisms like STTRs, which requires an academic entity to work with the commercial entity to be funded. There are also Commerce Rhode Island vouchers, which require collaboration between an academic entity and a commercial entity. So if there's a product, there's an idea, and you need certain types of technical or specialty expertise, if you find a partner, working together can actually help you access funds that you might not be able to on your own. I think that's once again, goes to collaboration and networking.
And it adds to the legitimacy of the product and the company, because those partners may very well, once you have IP settled, may very well want to publish the results. And if they're recognized by peers to be, good science and demonstrated effect that you're intending, then that's a giant feather in the cap of the company, that you have an evidence-based intervention.
Awesome. Thank you so much.
Yeah, and if somebody doesn't want to talk, you can also put it in the chat. Clotilde, actually, no, Aiden, you're next.
Awesome. Thank you all so much. This has been such an inspiring conversation, and I think this product should be everywhere. One of the things that I've always really admired about Loft's approach is just how human-centered their design process is. And so I was really curious, If there's anything you could share about how you brought in different end users or potential buyers or kind of other folks into the design process as you were kind of building this product out.
I think, Leo, maybe we're going to address the specifics, but part of the NIH grant was actually, working with the end users for their input on the design of the function. But Leo, do you want to flesh that out?
And so, and once again, sorry if this is like academic adjacent and, sort of like ivory tower, academic focus. But I mean, the reality is, our experience with SBIR, you have to propose a scientifically based, rigorous plan. And you have to have specific aims for SGTRs, SBIRs, and certain types of funding. And the reason I bring that up is because part of the requirement for securing the SBIR funds was to interact with end users, get feedback, and help revise the product based on their feedback. And so, just with respect to a specific product, we had initial prototypes. They're made out of Arduino circuits and, like reed switches or something. We would install them at specific locations. We would check on them remotely daily. I'd take donuts and, have chats with the people who were maintaining and monitoring them. I get feedback on how the system was working. Were there actual use cases and what were the outcomes? And so it became a combination of a qualitative and a quantitative research study, which helped, flesh out the details and make the product more usable, also generate objective data that validated what we were doing. And so, and all that feedback, we constructed surveys, and, there's a full industry and mechanism to create valid, safe surveys. But, we had surveys of end users, we had surveys of people who were maintaining the system, and we would do simulated mock-ups and, simulation sessions with these devices. So it's a very involved process, but it doesn't have to be ultra expensive. Like, you can create a survey monkey, as long as you create the survey questions properly in a safe manner. And, there are plenty of online references and resources to help you do that. Just trying to figure out how to simulate instead of doing real world life death studies. Because, fortunately, some things happen infrequently, so then those are very hard to study. But then you can simulate events, and that can help with your prototyping and user interactions. So,
Yeah,
a lot of ways around it.
The Center for Biomedical Research Excellence in Opioids and Overdoses is province-based, and they helped us with those first pilots Leo was talking about. And we had actual reports back on how the naloxone was used, which is super helpful. There are customer discovery programs through MIT and also through RI Hub, where you interview people, with your idea, who are potential end users or buyers. And we participate in the RI Hub program. The Nelson Center for the Brown undergrads they have a requirement of talking to at least 100 people about your idea before doing anything. So like, get out of the building, talk to people is a mantra that we've heard through our learning as entrepreneurs.
Yeah, I think even as we are kind of working on the initial platform, we did a lot of site visits. Leo and Jeff had good access to schools and hospitals and healthcare providers to just understand, where does it live? Like, where does the box even run? Like, understanding like power, like how do we get power to the box? All these things are really life needs that you don't really realize till you're actually there, right? You hear, and it's critical. I would say human-centered design is detrimental, especially for anything with a social impact, because you're so close to the user that it's detrimental that you're getting that value proposition right.
I love that. And I love the example of using simulations for learning, especially in such a high stakes context. So really appreciate that. Thank you so much.
Yeah, and I think, if anybody is thinking about like starting having a cool idea for a startup, I'm sure Leo will jump on a call and go deeper into the weeds. What I love about Leo, and don't take this the wrong way. He's like, if he doesn't know something already, he's on YouTube, he's figuring it out. He's a very resourceful guy.
Mhm. True.
Clotilde, you're next.
Yes, we talked about the most challenging parts of the development process, and supply chain, I'm with you, is not the most fun parts of the innovator's journey. What about the most delightful and wonderful parts of the journey so far?
Jeff, do you want to start?
Hands down, when Leo found out first thing in the morning that one of our units had been used for a successful rescue in a place that we weren't necessarily anticipating. So that's what it's all about. That was the best moment.
That's amazing. You want to talk about that?
And how much liberty are we, Leo? I think we
You
should.
don't have to give any details. Just
Yeah, yeah. Just it was the system is designed to send a message if the unit's been accessed, and the phone call. Leo can describe the phone call, but the phone call was made next morning. Hey, what happened at what was it, 11:45 p.m. or something like that, Leo, in your building? And the answer was, "Oh, let me tell you." So that was a rescue where somebody survived because the tools were there, and because of the phone call, they were restocked the same day.
wow.
And,
Well, that's amazing.
as mentioned, I mean, we've had several saves like that, and it's always validating and encouraging to hear that. In terms of the day-to-day of, doing startup and product development, I mean, it's always nice when, you join on a call with certain design partners, hint, hint, and, they show you some amazing, beautiful incarnation of something that you sent to them made out of like twine and cardboard. So, it's just like, and because it just makes it it just goes to show that, like, your idea can be put out in the real world and be acceptable.
Right.
And it's just really nice, to say, like, okay, well, we have something that works. Let's make it not pretty, but just just uh, what's the word? Just something that really can stand on its own and is easy to accept, because uh, I mean, there is the element of appearances. I mean, like, and so there are plenty of folded sheet metal containers that hold rescue supplies, and they do serve a purpose. But there are limitations in what that's been able to accomplish. And so being able to expand on that with the design UI and managing supply chain and getting a full product and having product product market fit, that's very validating.
That's amazing. Any more questions from anybody? I guess you guys answered all the questions. Well, just to wrap it up, I think we have about 5 minutes. I think one thing that, as I said before, I like the most is really, and I've heard this a lot from some of our clients, where they say it's pretty intimidating to basically work with a design agency, because obviously there's a lot of things at stake, but I feel like we've had a cadence of collaborations where, as I said, Leo, you come up with a box, we build around it. You say, yeah, I have a little bit of money now, but let's get started. I feel like it's also that iterativeness of the development, I think, has helped this product a lot, because we didn't say we're gonna build a box, here's $100,000, we're gonna get it done. It was more like piecemealed. We need these little things, just because of the reality of your funding, but also it gave us the opportunity to kind of learn how you guys work, and also how we can add the most value, right? Because I think one thing, as a design agency, sometimes it's hard to kind of also I feel like we're part of your team now, right? It's not just we are
Yeah.
our own ivory tower and you store something on the wall. It's a very kind of push and pull development. That's, I feel like, how the best work has always been done. And I'm glad that UK has, we're giving you the opportunity to do so by not saying, hey, at least you need 50 grand before we're going to talk to you. But at the same time, you're also saying, hey, I know that, I need to get to this milestone, but, let's figure that part out for now. Right. So I feel like this kind of collaborative effort and, to the greater ecosystem also, and you're having other folks that are helping you on the regulatory side, which is probably the same way, right? We just say, I have a little bit of work, I want to get to this milestone. I feel like startups have to operate that way a lot, right? Because otherwise it's just overwhelming, right? What are you going to solve? It's a huge puzzle and you don't know where to start.
Yeah, and I'm not sure all firms would operate like you do. We appreciate your open door of flexibility. You literally have an open door, and maybe you want to work on your security there because we keep on barging in. I think that the incremental process also is probably made us all a little bit more thoughtful about what we're doing, and at times slowed us down in a good way.
Right.
And so that was really nice. I mean, it's not like we went online at loft.com and ordered a product that got landed, and that's the end of the relationship.
Right. No, I agree. And I mean, it's probably also because of our size. We're not the biggest organization. We can have the luxury of having very personal interactions. Also, maybe because we all love working with humans. We're all here for doing cool stuff together. So it's really more about, not just the business transactional side of the business, but also the human side of the business, right? And especially with a product like you have to think about it that way, right? Because you're actively saving people's lives, right? I mean, and that's a mission that we can all line up for and sign up for. So yeah, as I said, it's been 2.5 years. I hope you will be clients for the next 10 years, 20 years. We'll see. But it's also really been fun. Thank you so much for jumping on this call, and I hope folks that joined in got to learn something. As I said, we're trying to make our webinars a little bit more actionable, just because I think people want to take something away, and it's really been working. So appreciate you guys collaborating with us, and also good luck with the next steps, and let's keep in touch.
Thank you, Gregor.
Okay.
Don't forget to mention the design awards that have come out of our collaboration.
Oh yeah, yeah.
Yeah, I mean, one side effect, right? It's helping Sora get legitimized, but also, we won the Design Value Award together. We won IDSA awards. We won a Good Design Award. Core 77 awards. So it's been really very rewarding also that people kind of get the product and want to support it. So thank you for everybody who gave us an award, but also thanks for giving us the opportunity to put such a cool product to life. Okay, take care.
Thanks.
See you guys.
Take care.
Goodbye.